Hi, everyone.
Hi.
Thank you for coming. Sorry if there's a little chaos in the beginning of this, but now we're settled and we are about to start the For Your Kids Care workshop. So welcome. Based on the name of the workshop, you can probably figure out what we're going to talk about today, and that is your children's health care. But we're going to do a little bit more than just talk about your children's health care today. We're going to remind you of something that you already know. And that is that you know your child better than anybody on the face of the planet. Am I right? Right. We don't want you to lose sight of that today. And some of you may know the information that we're going to share today, but that's okay. It will be a refresher for you. All right? But for those of us who don't, then let's learn some valuable lessons. Let's get some resources in hand, gain some knowledge, and we want to get a little added confidence so that you can make some really good health care decisions for your children. Okay? And that means sometimes taking care of your children at home when they have common illnesses. Okay, so are you ready to get started? Yeah. Okay. All right then. Does everybody have a folder? I need a folder. Thank you. Okay. Everybody have a folder. All righty. In your folder, in the left-hand side, you're going to see what we call a pre-post assessment. Okay? We call it a pre-post assessment because we want you to fill this out, answer the questions before the workshop begins. That's the pre part. And then at the conclusion of the workshop, you'll flip it over and you'll see that the same questions are on the opposite side. You'll answer those questions at the end of the workshop and you'll be surprised. Some of your answers might change. Okay? So I'm going to read it along with you. And we want you to circle the answer that you think is correct. But for now, if you could check off pre at the top and today's date. I know you know today's date, right? We have a birthday girl right here. Okay. Okay, December the 18th. I'll read it along. You just circle the answers that you think are correct. All right. Your child is 18 months old and has a fever of 100.4 degrees. You should either A, go to the emergency room, B, call the primary care physician, or C, give the child Tylenol. 2, your child put something in his or her ear. Using tweezers is a good way to get it out. Is that true or is that false? Finish this sentence. Fevers are either A, not common, you should take your child to the emergency room, or fevers are common. You should call the doctor when your child has one. 4, using Q-tips is a good way to clean your child's ears. True or false? 5, aspirin is okay to give to your child when he or she has a fever. True or false? And the last question, we want you to finish this sentence. Earaches in children under 3 years old are either A, not common, you should take your child to the emergency room, or earaches in children under 3 years old are common. You should call the doctor when your child has one. And when you're finished, you can slip it right back into your folder. We'll change it.
Okay. Good morning, ladies and gentlemen.
Good morning.
Okay. I'm Marsha Walker, one of the facilitators for Your Kids Care. We'd like to begin by asking you to introduce yourselves and tell us your children's ages and how many you have. We're going to begin with you.
My name is Nadira Jones. I have a son. His name is Yazir Jones. He's 3 years old.
Welcome.
My name is Cheryl Walker Robertson, and I have a niece, and she just turned 1 year old Wednesday.
My name is Anissa Tucci. I have one kid, Sharon. She 3 years old.
Okay.
My name is Dior Scott. I have a son, Gavin, and he's 4.
My name is Anne-Marie Robinson. I have 3 kids, 8, 5, and 2.5.
My name is Consuelo. I have 2 kids. One girl 7 years and one boy 5 years.
Okay. Introduce
My
you.
name is Rogelio. I got 2 kids. The name is Jael. He got 5, and one girl is 7.
Okay. Welcome.
My name is Janetta Behrman. I had 2 boys. One is 5, Hezekiah, and the other one's 8, Japri.
Okay. Welcome.
My name is Jean Barron. I had 2 grandkids, and this is my daughter, Janetta.
Okay. Welcome.
My name is Val. Good morning. My name is Val Quiller. I have 2 children, a 7-year-old Jeremiah and a 4-year-old Christian.
Okay. Welcome.
My name is Jerry Trent. I have 2 children. One is girl, one boy. I was just turning 4 years yesterday, and that's fine.
Okay. Good.
Hi, Meg Grant. I have a 5-year-old son, Ian.
Hi, I'm Beverly. I'm a Keystone facilitator, and I don't have any children.
And I'm Alice Honeywell, and like I said, I'm the community health educator at Keystone First in Pennsylvania, and I have 2 grandchildren, aged 13 and past.
Okay. So before we begin our conversation, we're going to go over some situations to see what would you do in this particular situation. And the first one is your little girl is 18 months old and has had a cold for 7 days. She now has pain in her chest and also has a dry cough. So would you A, call the primary care physician? Who's calling the primary care physician? Okay. B, give her cough medicine you got from the drugstore? Okay. C, go to the emergency room? Okay. And D, give her Tylenol. Okay. So when we get to those subjects, we'll tell you what the experts say is the correct answer. The second one is your 2.5-year-old girl has a history of earaches. She won't go to sleep and didn't eat all of her dinner. She feels warm. You take her temperature and it's 100 degrees. Okay. Would you consider this an emergency where you go to the emergency room? Who's going to the emergency room?
No.
Okay.
She's sick right now, actually, and she's 2.5 years old. I give her Motrin, and then first I called the primary doctor.
Okay.
And then they recommend to take her there, and then they said it's nothing, just virus.
Okay. Anybody doing something different besides calling your primary care physician or going to the emergency room? Okay. Next one. A 3-year-old boy's father touched his forehead and it felt warm. He took the child's temperature. It was 101.2 degrees. The boy complained that his head hurt. The dad made him breakfast, but the child didn't feel like eating. The dad also gave the boy some juice and children's Tylenol. Following morning, the fever was 101.0 degrees. The boy was still tired, aching, and not interested in playing with his toys. So what should this father do? Would you consider this an emergency where you go to the emergency room? You go to the emergency room? Who's doing something different? Anybody? What are you going to do? All right, call the primary doctor. Excuse me. And finally, you had this little cutie. You put your 9-month-old baby to bed an hour ago. She has been crying and fussing the whole time. When you check on her, you see a thick yellow substance coming out of her ear. Look at that face over there. So what would you do? Emergency room? Anybody doing anything differently besides going to the emergency room? Emergency room. Primary care and go to emergency room. Very good.
On your way, you call.
Right. Okay. So we would like for you to think about a situation that you've had with your children or a child that has been in your care? And where were you on a scale of 1 to 10? 1 meaning, I got this, it's no big deal. 10 meaning, I'm about to lose my mind. Anybody have any experiences? And since children don't come with manuals, they don't have instructions on their feet, they're budding scientists, they are constantly getting into something. So that's why we ask you to share. Nobody? No blood and guts? Thank you.
Once when my son, he was about probably 2 weeks old, and my cousin was holding him, and he just started shaking and throwing up and stuff. So I jumped up, and she jumped up and gave him to me. I didn't know what to do, so we just ran straight out the house and went to the emergency room.
Okay.
And it was just acid reflux.
Okay. So on a scale of 1 to 10, where were you?
A 10.
Okay, a 10. Anybody else? No broken bones anywhere, no jumping off the bed, running into anything?
Yeah, my daughter, she broke her hand when she was 2.5.
She broke her who?
Her hand.
Oh, a hand. You know, I thought you said head. I wanted you to explain that. Okay.
And then everybody said, okay, she's fine. Just like she's going to cry a little bit and then she's going to be fine. The second day, her hand was swollen.
Okay.
And then I called, they said take her to the emergency room. It was building and it's a fraction.
Okay.
So, and she put the cast for 3 months.
Wow.
So thank God I took her because they said she's okay, but the mommy feels different than other people.
Okay. Anybody else?
You know, one for my daughter, when she was little, she had asthma and we didn't know it, and she was gasping for breath, and only when she went to sleep, and we took her to a hospital, and they said she had asthma.
Okay.
And she had severe asthma, and the medicines didn't work, and we went natural with the, along with the doctor, but you have to work with your doctor with it, and now today she doesn't have asthma.
Okay, good.
And then another time, just July before, I took my grandson to the park to play, what do you call it, the monkey bars. And he got on the monkey bars, and I was sitting down like this here, and I just heard something snap. And he had fell off the monkey bars, broke his arm, and I had his bike. I was ready to give a bike to another kid to try and get him home because his arm was swelling up as I walked. And he held on to the bike and me. Got us home, and I'm calling her, telling her, hurry up and come home. But I had to go to the hospital. I'm going, where's the cops when I need them?
So he did break his arm. Okay.
And he had to have emergency surgery.
Oh, okay.
As soon as we got him here.
And on a scale of 1 to 10, you were a 12. Okay. All right. One of the reasons why we ask you to share those things with us is because Keystone really wants you to understand that you're first in your child's life, and your child's well-being is a collaborative effort between you and your primary care physician. Does everyone have a primary care physician or pediatrician? Do you have one that you like? Okay. Because that's important.
Not me, actually. I do want to look into changing his.
Okay. Keystone does encourage that. You need to have somebody that you can trust and somebody that you can talk to. Because, like I said, this is a collaborative effort. So one of the things we want you to remember is the Ask 3. That whenever you go, whenever you go to the doctor, whether it's for yourself or for your child, you should always ask 3 questions. It's really important. You need to know what's the main problem. There's a reason why you were there. You really need to know what it is. You need to know, what do you need to do? Because there is always something that you need to do. That's your part in this. And the third thing is, why is it important for me to do this? Because sometimes, like when you take meds, you give your kids antibiotics, and then you start to feel better, or that little person starts tumbling and rolling all over the floor, and you think they feel better, and you stop giving them the meds. Well, you don't need to do that. So it's very clear that you need to always understand why you're doing what you're doing. And we strongly recommend and suggest that you always ask questions. And if there's somebody, like she says, she's not really happy with her primary care physician, you do need to change, because you do need to have somebody that you can trust and that you can talk to. The other thing that Keystone put together, Alice, I don't think I can put that back. is this. You'll find this in your folder. And it's a good reference. We recommend that you read this at your leisure. Please don't grab this information when your child's turning blue. That is not what we're suggesting. But this is another resource for you. And you'll see the question is it an emergency? And it's for things like chest pains, choking, poisoning, severe wounds. But coupled with calling 911 or going to the emergency room, we strongly recommend that you call your primary care physician first, because that's your partner, and or the 24/7 nurse call line. Have any of you used that number? Okay. It's a good reference. We recommend that you put it in your phone. And when you call them, they're either going to talk you off the ledge, or they'll say you need to go to the emergency room or whatever. And it kind of helps minimize that panic that you might have, because as parents, we think everything is a reason to panic, but it may not be. So you're building a relationship with them. They're also there if you just have a question. One day you're sitting around looking at Dr. Oz and he starts talking about something and you're curious about it, you can call them. They are always there. They're there Christmas, when nobody else is. The second thing is urgent care, which is in the orange. That's something new that's come up. And urgent care centers, Rite Aid has them, Walgreens, Walmart, different places, CVS, because sometimes you don't need to go to the emergency room, but you need to see somebody. And like I said, it could be Christmas night. Your doctor is absolutely not working on Christmas night, but you might need to see somebody, and that's where an urgent care center comes in. And that's for things like coughing, vomiting, diarrhea, sore throat, etc. However, we strongly recommend that you call and you find out where an urgent care center is in your area. But also ask them if they see children under 12, because we found out that there are some urgent care centers that won't see children if they're under 12. So you want to be armed with that just in case you need it. And of course, the last color is green, and this is you get care, from your doctor. So it's toothache, sunburn, skin rash, etc. However, one of the things we say that when you begin to notice something different about your child, that you start to jot things down, because the more information you have, the better it is for the healthcare provider that you're talking to. Sometimes some of these things by themselves may not be an emergency, but together, if your child is vomiting, they have diarrhea, they may have a stiff neck, it means something else. The other thing that Keystone put together for you, one is that acronym, A Healthy Baby Begins With You, but that's a healthy child too. And whenever something happens, you only have a few minutes to panic, and you need to focus on what's happening. You need to identify what you see. Like you said, you heard the break, so you identify. You don't have to know what it is, but you know something's going on. You responded to what you could do. You called her. You looked for a police officer. Skills. As a parent, you just have some skills instinctively. You don't have to have been trained. You know if your child's bleeding, you're going to spring into some kind of action, and you will take action. So we want you to remember that you're always first, and sometimes you will be accused of being an overprotective parent, but that's okay. The other thing that Keystone put together for you is this book. We really like this book. Keystone First liked this book so much that they had the covers reprinted to have their information on. So it's meant to be parent friendly. If you open the cover, you'll see they have places for you to fill out things such as your medical card, your pharmacy, your doctor's name, because in the middle of a panic, as well as you know your children and how old they are and when their spots are. So these are things that are common in children. If you turn the page, it's what's in this book. Again, this is a typical table of contents with chapter and topics underneath. This book is not meant for you to read front to back, but just kind of flip through, familiarize yourself with what's in there when you're on the bus, when you're sitting in the waiting room. If you turn the page, safety tips. That's the first chapter. We know that you can't always get the things, but if you can, safety tips are really good. That's a really good chapter, because sometimes there are things that we can do as parents that will help prevent certain kinds of accidents. But one of the things in front of each chapter, they have notes. This is where you begin to see a word list. So when you're looking at Dr. Oz, or if your doctor is talking to you and they use words, you're not sure what they mean, this is what the word list is for. You may also want to use the word list when, again, it's what's in this book from A to Z. So you heard something about belly pains and you're interested in it. You would go in the index and you would find the topic and stuff in there. On the back, Keystone has all the important numbers that you need. One is member services. That's who you'd call. They're one of your best friends. You can call them and ask questions. They can call you by name, and it's okay. You can never call them enough. That's why they're there. Bright Start prenatal program. If any of you are interested in getting pregnant again or you have a bonus child, that's a good program, okay? They do very well for you. They give you good breast pumps. They have nice baby showers, and it's a good resource. EPSDT, they're people who invite you to things like this. They also tell you when you're...
I really like that book a lot. Okay. The number one reason why we take our children to the emergency room is because of upper respiratory problems. Our child has stopped breathing. That's a really good reason to take our children to the emergency room. Wouldn't you agree? Mm-hmm. You want to guess what the number 2 is?
Fever.
You got it. Fever. Fever. Where's that colorful poster? Yeah, here it is. This one. You have this in your folder, but if you scan it, you'll find fevers are located in the green box. And what does that green box mean? It's not an emergency. Because for the most part, fevers in and of themselves just aren't emergencies. They aren't emergencies. As a matter of fact, a doctor will tell you that a fever is a good thing. You ever heard that before? A fever can be a good thing. The body's fighting the infection, exactly. See, our bodies always try to protect us. Just like when you fall down, you skin your knee, you get a scab. That scab is the best Band-Aid you could ever buy from CVS or Rite Aid. Real. The same thing happens, or similar thing happens, when you get an infection in your body. The body wants to protect you. So the body gets warm, because in warmth, those cells are revving up so they can attack the infection and kill it. So a fever, in fact, is a good thing. Your doctor wants your child to get a fever just like your doctor wants your child to get a scab. A fever is common. It lasts for about 2 or 3 days. It's not an illness. And although it's associated with seizures, it's not how high the fever is, it's how quickly it rose, right? You hear about seizures and fevers, and it scares us, right? Now, in the olden days, we used to think that if a child had a seizure because of a fever, then they would get brain damage. We now know that that's not the case. So, a fever is considered a good thing. Now, there's some exceptions. The exceptions are, if your child is under 2 months old and gets a fever, then that could be an urgent situation. In that situation, you know what we want you to do? We want you to call somebody. We want you to call your primary care physician, but it's Christmas Day, right? Because that's when kids get sick, right? You have that 24/7 nurse call line. That 24/7 nurse call line will then call ahead to the hospital, pre-register you so that you do not have to wait in the emergency room. Because we don't want to wait in the emergency room. What's in the emergency rooms? More germs. More germs. Germs swirling all around you. And you have to sit and sit and sit in the emergency room because your child has a fever, because the doctors and the nurses don't think your child is an emergency. You're there for 8 hours being surrounded by germs. Also, you know, emergency rooms are for emergencies. So you have emergency room doctors in the emergency room. Your primary care physician is your partner in this. The emergency room doctor does a good job of being an emergency room doctor. You have a relationship with your primary care physician, and that's the one you want to cultivate. So your child is 2 months or younger, it could be an urgent situation. The second reason that might be an exception is if your child has a special condition. I can think of sickle cell anemia, for instance. If your child has sickle cell anemia, your doctor probably has told you, you probably have to hightail it to the emergency room. You do what your doctor says. Make a phone call first. And the third reason is a really good one, and that's mommy gut, daddy gut, grandmom gut. Because remember what I said earlier? You know your child better than anybody on this planet. And if you think that your child has an emergency, you forget what this lady with the bright orange shirt says. You go to the emergency room. But the only thing that we want you to do is make a call first, because you do not want to be in the emergency room with a child with an emergency and have to sit for 8 hours. Remember what Marsha said? You make the call to the 24/7 nurse call line, and they'll either talk you off the ledge, because not every time your child is in distress doesn't mean that your child is in an urgent situation. They'll either talk you off the ledge or say, yeah, I think this is an emergency. Let me call ahead so that the hospital can be ready for you. See how important that 24/7 nurse call line is? We want you to put it in your phone before you leave.
I did call them before.
You did, and what was your experience?
Actually, they're very good. They tried to call me every hour because I thought my daughter, she drank something like for cars cleaning.
Oh.
And then that scared me a lot.
I
And then
bet that
she
did.
said, okay, just wait 1 hour. If she throw up or something, take her to the ER. And then my daughter, I smell her mouth. It's nothing, but you know, I'm scared a lot.
Mm-hmm.
And then they keep calling me till 7 a.m.
Mm-hmm.
All night, every 1 hour.
Mm-hmm.
So good.
Mm-hmm.
Awesome.
Mm-hmm.
This number, I remember this number.
Yeah, yeah. That's a great testimonial. We all want to put it in our phone now, right? Yeah.
Calling me.
Yeah.
So good.
I said that a fever is generally a good thing, that you want your child to get a
there's,
fever.
Like, different things. And my other one, she put like a ball, a small ball in her ears, and then I'll take her to the ER right away because. And then they called me. They said, don't let her eat or drink anything or talk because we don't want the thing move and calm down
Wow.
more. Thank God.
We need to take you on the road with us.
Yes. If I bring my kids here, just take them and go.
What do your children look like and act like and feel like when they have fevers?
Oh my goodness.
Hmm? They're quiet. Okay, for once, right?
They're never quiet.
Okay. Oh, do you have a child who acts the same as
Like,
he
I
does
have
when he doesn't have a
fevers,
fever?
Like, you know, they fight a lot. They just like, they do things you don't even think what they doing. And my mom, she said, take them and leave.
Hopefully there's an adult in their presence then. Okay. Wow. What do their eyes normally look like?
They have beautiful eyes. I don't know.
Well, when your child has a fever, what do your children's eyes look like? Are they glassy, red, puffy, maybe a little bit?
Sleepy.
Yeah, they're sleepy. They want to rest. Do they want to eat normally?
I just left my 2.5. She's sick and she's like this. But I took her to the doctor yesterday.
Oh, good.
They said virus from the season.
Okay. Now, was your child warm?
She was 102.2.
But how did she feel when you
Warm
touched
and
her?
red
Mm-hmm.
here.
Yeah. Because normally our children feel warm when they have fevers, right? Right?
Very warm.
Now, all of those are symptoms of a fever. Yeah. Don't want to eat. The eyes are glassy. Right. Lethargic. But how do you know for sure if your child has a fever? You got to take the child's temperature, right? Because that child could have been out in the hot sun, come inside, and the child is warm, but not necessarily have a fever. So, taking the child's temperature will verify that for you. All right, so let's name all the different kinds of ways that a child's fever can be taken. Let's go. Mouth or orally.
Underarm.
Under the arm.
Ears.
Excuse me? Anally or rectally. By the way, anal and rectal doesn't flow off my tongue very easily. So I call it booty wise. All right? How else? The ear. There's that strip, and then if you go to Children's Hospital, they have that thing right out of Twilight Zone, just scans your forehead. Yeah. How else? Well, you the underarm.
We say the mouth.
Mm-hmm. Said the mouth.
The other thing
How about this here?
behind the knee.
Okay. Have you seen the binky, the pacifier? What's that?
I know the works, but I have seen it.
Yeah. Now I got you with this one. There is an app on your phone where you can download a thermometer. Have you seen that?
They told me that, but like not any iPhone.
Excuse me?
Not any phone. The new phone.
Well, it's on my phone, but it didn't have to be because I downloaded it and said my temperature was 93 degrees. You know, a blood pressure? Really? Mm-hmm. Well, blood pressure and fevers, but I can't give an endorsement for it. But there's so many different kinds of ways that you can take your child's temperature. The 3 primary ways, you named them: orally in the mouth, the armpit, or booty-wise. Okay? Now, of those 3 ways, which one gives you the more accurate reading?
Underarm is good.
Booty-wise. Had to be that one, right? Yeah. What's that? The one you don't want to do. Right. Good. Think of it this way. A normal temperature is what?
98.
98.6 if you look it up in a book. 98.6. But that is the average temperature. Your child's normal temperature might be 98.7. Yours might be 98.4. Take your child's temperature when your child is feeling good, then you know when your child has a fever, right? If you take your child's temperature orally, a fever begins at about 99, 99.5. If you take your child's temperature booty-wise, a fever begins at about 100, 100.5. That 100, 100.5, that's the accurate temperature, and that's why doctors prefer you to take your child's temperature booty-wise. Up until what age? She said 15. She said 15. About what age? 5? 10? Okay. This is what I say. When your child turns around and says, "What you doing back there?" then you know it's time to stop. That's usually about age 3. Okay, that's usually about age 3. But if you can do it at age 10, feel free, if he lets you do it. Okay, so have any of you ever taken your child's temperature booty-wise?
Yes.
Yes?
And it was a struggle.
It was a struggle. Do any of you have children under 3 years old? Now? You do? Do you take your child's temperature booty-wise? Yes. You take your child's temperature booty-wise. Well, a lot of people don't like to do it for obvious reasons.
The nurse told me to do that.
Look how long this probe is. You see? And a lot of people think, ouch, No. They think it hurts the child, but it really doesn't. Because you see the tip? That tip is the only thing that takes your child's temperature that's maybe a half of an inch. So when you insert it in your child, you only have to insert it about a half of an inch. So it does not hurt your child. Does not hurt your child. Another reason that I hear that I think is a little bit more legitimate than the first reason is that it has a sexual connotation to it. We teach our children, do not let anybody touch you back there. And what are we doing? We're touching them back there. The doctors still prefer it because it gives a more accurate reading. Right. Have you seen the strips that you put over the probe? You use them for sanitary reasons. You put the probe on, you put the strip on the probe. After you finish using taking the child's temperature, you throw the strip away. It's more sanitary. We suggest that you also wash and clean your thermometer just the same. If you're taking your child's temperature booty-wise, what kind of lubricant are you going to use? What lubricant? Vaseline? Okay. Vaseline is a brand name. So what's the product? Petroleum jelly. Yes, you can use Vaseline or petroleum jelly. But I just want to warn you that your book tells you not to. Your book tells you not to because Vaseline is not water soluble, so it's harder to wash it off. It's harder to get it clean. But the doctors say you can use it because for the most part, what they recommend in the book, we don't keep in our medicine cabinet. Do you know what that is? KY jelly, right? So if you have KY jelly, then that's fine. If you're not taking your child's temperature that way because you're a little wary, that KY jelly doesn't help you in your thinking. But remember, KY jelly is the brand name. The product is the jelly that they give you when you go to the doctor and they take your child's temperature that way. When you go to the hospital, that's what they're using. Good old-fashioned KY jelly. Okay? All right, so let's take you're used to taking your child's temperature that way. So I won't go through that process, but you're familiar with the digital thermometer? Okay, you know that you beep it, and then about a minute later after you apply it, then it tells you what the temperature is. So let's beep it. All right. I'm taking your child's temperature right now. My child's temperature is 102. What are the numbers that I'm looking at on the display here? What does 102 fever look like when you write it down?
1002. Point, decimal 2. Yeah. No.
Is that right?
No. 102.0. 102.0.
Which one's right? The second one. But that's why I asked this question. That's why I asked this question, because you see, our eyes and our ears and our mouths and our minds, they don't work in sync all the time, all right? You may be saying 102, but mean 100.2, right? So always put that point in there, and then that way you can communicate well with your doctor, right? Okay. So let's say the temperature is 100.2 degrees, 100.2 degrees. If the temperature is to go up, what is the next degree that it goes up to? What increment does it go up to? 101. Say 100. 100.3. What did you say?
101.
101. It goes to 100.3 first. So we have 100.3, then 100.4, 0.5, 0.6, 0.7, 0.8, 0.9, and then it turns into 101. Now it's 101.0, and it's going up. So it's 101.1, 0.2, 0.3, 0.4, 0.5, 0.6, 0.7, 0.8, 0.9. Finally, it gets to 102. There's a vast difference between 100.2 and 102. That's why it's important to communicate it well with your doctor and put that point in it, right? Always put that point in there. That way, you won't make the error that so many people do. I make that error sometimes. And have to remind myself to put that point in there. You got it? Okay. So we said a lot. We said that a fever is going to run its course. It's going to last for about 2 or 3 days. We don't want the fever to go up, but it's going to run its course. In that period of time, your child is at home. So what are some of the things that you can do to make your child feel comfortable when your child has a fever and your child is home?
Motrin every 6 hours.
Let's talk about Motrin. Motrin is the brand name. What's the product? Ibuprofen, right? Then there is Tylenol. Tylenol is the brand name. What is the product? Come on. Come on. I know, it's a mouthful, right? It's acetaminophen. Yeah, you were close. It's a mouthful, we understand. So we have Motrin and we have Tylenol, and yes, those are good ways to make your child feel comfortable when your child has a fever, if you're comfortable giving your child medication. Now, this is the thing. Your doctor wants you to call him or her if your child is under 2 years old before you give your child Tylenol or Motrin. Okay. Once he says or she says it's okay, then you can go ahead and do it. But remember, each child's an individual. Your grandchild is different from your child, who is different from your child. It might be okay for your grandchild, who's the same age as your child, but it's not okay for your child. That's why you really want to check with your primary care physician, your collaborator, your partner in this. Okay, there's some factors that go into whether or not it is safe for your child. So, yes. Oh, and by the way, Tylenol and Motrin are not fever eliminators. They are fever reducers. Because remember what I said? The fever is fighting the infection. You want your child to get the fever, but it lowers the temperature just enough so that your child feels comfortable and yet it's able to fight the infection. Got it? Okay. So how else can you make your child feel comfortable when your child has a fever? Very good. Very good. We must hydrate or give our children something to drink when our child has a fever, because dehydration can be very, very serious. So what do you give your child to hydrate your child?
That's a good question.
Pedialyte. Pedialyte is a good thing.
What if you don't have Pedialyte? Because most of the time I don't have it.
Gatorade. That's why we're naming a whole lot. We're going to name a whole lot until we reach one that you have. Water. Excuse me?
Is apple juice okay?
What's apple juice?
Apple.
Oh, apple juice. Okay. Now, apple juice will hydrate your child, but consider this. Juices have acid in them. Acid can aggravate an already sore throat or tummy. All right. So, but
I never know what to give them. Like water is not enough.
Does your child like apple juice? Let's say her child liked apple juice but didn't like water, didn't like Pedialyte or anything else. Give your child apple juice, even though it has the acid in it, because you have to hydrate your child. Water it down. What's water it down?
I gave him a freeze pop. Was that okay?
Freeze pop is good. Freeze pop is good. Freeze pop tastes good. Freeze pop is a little cool, and freeze pops will hydrate your child too. Any other ways that you can think to hydrate your child, to give more options? We heard water, right? What? Would go old-fashioned water? Anything else? Excuse me?
Water, Gatorade, and Pedialyte.
Just watch the sugar in Gatorade. It's filled with a lot of sugar.
For the stomach, it's good. For the virus.
Well, we're talking about the fever now. So for the fevers, we want to hydrate the child. Gatorade will hydrate your child. All I'm asking, or what I'm saying is, Gatorade, just like soda, has a lot of sugar in it. You want to water it down. Okay. All right. Oh, and soda's not good for our children. No, soda's not good for our children. It's filled with loads of sugar. It's filled with loads of sugar. Can you think of any other ways to hydrate your child? Like good old-fashioned chicken soup? That's an old-fashioned remedy. That's one of those old remedies that we used to do when I was a child. And we do it now, right? Right? You know why it works? That old remedy works because it has salt in it. And salt helps retain or absorb the fluid, the water. So it's good for hydration. So that's why good old chicken soup, good old-fashioned chicken soup is good. Now, if you go to the supermarket and you pull a can of Campbell's soup off the shelf, and you turn around to read the nutrition label, and you see 1,190 milligrams of salt, that's a lot of sodium. That's a lot of sodium. Water it down.
It's not about how high it is, but how fast it goes up.
Yes.
Okay. I guess for me, it was like when I forget what the fever was for my son a while ago, but it was pretty high, and I just kind of felt that he needed to go to the emergency because it was like really high.
If you think he has a seizure, then you're definitely making a call, and you're definitely going to the emergency room. But if the fever is high, that doesn't necessarily mean that it's an emergency. Let me give you some guidelines, because there is a poster here. And this is in your book, and it's in your folder. Nice guidelines. You call your primary care physician if your child is younger than 2 months old and has a fever of 100.4 or higher. Your child is 2 months old and has a fever of 101 or higher. Now your child is still a little itty bitty thing, 6 months old, and has a fever of 103 or higher. Who you gonna call? The primary care physician, the 24/7 nurse call line. It may seem like an emergency, maybe it is, but we want you to make a call first, because a fever is a good thing. A fever is fighting the infection under most circumstances. Okay? All right.
So, how do you know when your child has an earache? Touching, what else? Touching. Yeah, doing like that. Pulling on it, maybe rubbing it on something. Earaches are very common in little people, okay? Children get them a lot the younger they are. Couple of reasons. Number one, fluid or liquid in their ear. How's a little person get liquid in their ear? Shower, bathing, washing their hair. How else?
Swimming.
Yeah, swimming. How about a bottle? If you put a baby down with the bottle and the milk, juice, or water kind of drizzles into their ear, or even lying down and crying. So mainly it's fluid in their ear. They'll get an earache. The other way is if they have a cold or a respiratory infection. The ear, nose, and throat are all connected. So a lot of times when your child has a cold, they may get an earache or ear infection to go with this. Sometimes you don't even know. You take your child to the doctor, and the doctor examines, and he can see, or she can see some infection there. But there's a third way. What do you think that is? Teething, but that's not so much as this other way. Smoke. Cigarette, pipe, tobacco, marijuana, smoke triggers an earache, ear infection, asthma, respiratory problems, and allergic reactions. So we all know firsthand smoke. We never smoke around our child. Secondhand smoke is what? What's secondhand smoke? When you get into somebody's car and they've been smoking, you walk into your mother-in-law's and everybody there smokes. Even if they're not smoking, then the smoke is there. Smoke stays in an environment 9 days. But now they know there's a third way, and it's called third-hand smoke. What do you think that is? What's third-hand smoke? Maybe like your clothes, your upholstery, the drapes, your hair. So you know those people that smoke with the cigarette out the window and they got a car full of kids? Go outside and take a smoke and come back in. Cigarette smoke stays in an environment and on you for 9 days. So you really have to be one of those kind of parents that just kind of keeps people away from your child when they're smoking. Okay, you really do. If you have people in your household who are Keystone members and smoke and would like to stop, Keystone will do anything. Medication, the patch, support groups, the gum, anything, any kind of support they need to help them stop smoking, because cigarette smoking is detrimental to everybody, okay? Ear health is really delicate, so doctors really don't want you to clean your child's ears with Q-tips. And the reason for that is, first of all, if you're using a Q-tip and your child has put something in their ear. How many people have had children put stuff in their ear besides you? We know you had the bead. What have you found in your child's ear?
I didn't find anything. My child actually, unfortunately, did something that I did. He saw me use a bobby pin, and so he tried to
Do
not
the
at
same
time,
thing.
but I think later on. or
Absolutely.
something, he tried to do the same thing.
Absolutely.
And
Yeah.
So it wasn't stuck, but he still.
Yeah, yeah. And that's one of the other reasons why doctors don't want you to use Q-tips, because children do what they see, and then they go to do the Q-tip or stick or pencil or bobby pin, and they really hurt themselves. But children tend to put things in their ears. So if your child hasn't put anything in their ears yet, okay, be aware, because children tend to do that. They put things in their ears, they put things up their nose. Okay, so you may know or not know that they put something in their ear. Q-tip is going to push it down further. It will push any earwax down further. And again, children will do what they see. Now they're going to try to do it. Okay, the other thing is part of that cotton can actually come off, and you may or may not know it. So doctors really want you to clean their ears with a washcloth. That's it, just a washcloth. Now, there's some children that have earwax issues. They need their ears cleaned regularly. Sweet oils, earwax kits. They have an ear vac now, peroxide. And I'm going to stop and talk now about OTCs. What's an OTC? Over-the-counter drug. Over-the-counter is anything you can go in Rite Aid, CVS, and just pull off the counter. A lot of times people will think that peroxide, that's a old-fashioned remedy. All of us have it in our medicine cabinets. Sweet oil. I heard somebody say earlier, when it's a natural product, it's okay. That's not always the case. The bottom line here is you never want to use anything on your children or in your children until you've run it by a doctor first, especially a doctor who knows your child. You may need to call the hotline if you can't get your doctor, but the main thing is, even if it's something you've used on your other children, even if your next door neighbor's daughter-in-law, sister's brother is a naturopath healer and they use it all the time, or something that comes out of the earth, you want to try first to run it by your doctor. Okay, you don't want to be one of those parents who goes to the ER and the doctor says, well, you really shouldn't have done that. Okay, so always check first, okay? And while we're talking about over-the-counter medicines, and that goes for anything, even though it may say children's medication, when your doctor prescribes medicine for your children, doctors don't like to give little people medicine unless it's really important. So when the doctor prescribes medicine, it's really important to give that medication exactly the way it's prescribed for the length of time, using the exact measurement, because they prescribe medicine not only for your child's age, but also for your child's weight, okay? And also for what they know about your child. Your child may be allergic to an ingredient in something that's over the counter. So again, giving that medication exactly the way it's prescribed, and dosage is very important. You've got to use the same cap, dropper, spoon, cup that comes with the medication. If you lose it, go back to the pharmacy and get another one, because we could swig out of the cough medicine bottle. Not that we do that, but we could. For little people, dosage is very, very important. And as you're leaving the pharmacy, make sure you're checking the expiration date and you have the right medicine. You can't give that medication to your 2-year-old that you've used last month for your 6-year-old, even though it's still good, okay? Always, always check before you use anything on your child for the first time, okay? And then you're okay. So back to ear stuff. So your child has a bead in their ear, or a stick, or a bug, or a piece of food, and if you can see it, go ahead and pull it out, get it out. But if you can't, don't go digging in there with tweezers, knives, forks. Don't do that. Call, make a call. And depending on the situation and what you describe, remember you're the expert, so you're going to give the doctor all the details. The doctor may say, drop everything and get to the ER. The doctor may say, okay, take her upstairs, put her over the sink. They may tell you what to do. But always check. You just never want to dig. And that's just also a clue for remembering to check your children from time to time during the course of the day or maybe at bedtime, and making sure that, you know, they don't have anything lodged. And sometimes they go to daycare or school and they put stickers or things on their bodies. You really have to be very, very diligent and vigilant when it comes to your little people, okay? For any of you who may be planning on getting pregnant, or maybe you've not planned but you get pregnant anyway, think about breastfeeding, because breastfeeding is something that helps to build your child's immunities. And that means that your child is going to get less infections, earaches, colds, all kinds of things. And when they do, they're going to be able to fight them more effectively. So breastfeeding is something to think about. And Keystone offers parents through the Bright Start program free breast pumps. So you can pump and go. You work or you have things you need to do. That's not something that has to confine you. And have a really good support system if you're interested in doing that. So keep that in mind, okay? Any other questions or comments about ear health? Anybody here have children who have serious earache situations, who've gotten earaches regularly? Now remember the little girl that was 2.5 and had the history of earaches we talked about in the beginning? This little girl, she had a history of earaches, and she's 2.5. She gets them all the time. Remember her? Okay, mom knows the symptoms. She wasn't sleeping, she wasn't eating, warm, making sure enough, temperature of 100. You call the doctor, okay, and the doctor says, maybe, you know what? You know what to do. She gets them all the time. I'll call in a prescription, okay? Or the doctor may say, this is the second one in a month. She's got those antibiotics in her system still. It's time now to see a specialist. We need to do something more. Or the doctor may say, this is too many earaches in a short period of time. We have to do surgery. We have to put tubes in the ear. The adenoids have to come out. Ear health is an important issue for little people. And over the years, as they get older, they usually grow out of ear issues. But if you have children with earaches, you don't need to panic. Make a call. And depending on the situation, it may or may not be an emergency. Remember that little 9-month-old baby that had the ear? He was whining and fretting, and you put him down like an hour ago, and you go in to check on him, and it's like thick yellow stuff coming out of his ear. Ooh. Is that an emergency? What do you think that was? That's that yellow stuff. Infection. Yeah, that was the infection. But let me ask you this. Now think about this. The infection is coming out. So is that a good thing or a bad thing? Actually, it's a good thing. And as it comes out, it relieves some of the pain and the pressure. That doesn't mean that it's not something you really need to find out about, because depending on the situation, the doctor may say, okay, good, the infection's coming out, I'll call in a prescription, bring them in tomorrow. Or the doctor may say, you know, he's 9 months old, that's pretty serious and severe for a first time, get him to the ER, I'll meet you. What we want you to know from these situations is that you don't need to panic. You are not alone when these things happen. You always have this phone number. You can be calling your primary care on your landline and the 24/7 hotline number on your cell. The point is, you never have to make that decision by yourself. You asked that question about the fever, how the temperature was just really high and you were really nervous. Things happen and you're not really sure. You don't have to make the decision by yourself. You always have that 24/7 hotline number. And hopefully your own doctor will get back to you sooner, because that's your first partner. But the bottom line is that you don't have to panic. And you mentioned that mother's instinct. Sometimes you have a situation like the 2.5-year-old that's had earaches over and over. You've seen this repeatedly with this particular child, but there's just something different about this situation. It's not always a physical symptom. It may be their behavior. It may be the way they're looking and they're staring into space and you do like that. That's why it's very important for you to be very observant. Always looking at everything about your child. They may be speaking to you and their speech is slurring because their tongue and their throat has swollen up. You are the expert, so you always want to pay attention. And again, you don't have to panic because you have support out there, okay? You have support, okay? The only thing that's more common than earaches with children are colds. And unfortunately, your child's probably going to get 4, 5, 6 a season. That's because colds are very, very contagious. So, of course, you want to teach your children to wash their hands. This is a joke. Teach them not to eat or drink after anybody. Another joke. Keep the sick kids away from the kids who aren't sick yet. But basically, you're going to do the sanitary thing. And when your children do get colds, and especially if you have more than one child in the household, they're going to be back and forth with that. So how do you treat a cold at home? What do you do? What do you do?
I remember my kid getting a cold.
Did you breastfeed?
Yes.
All right. There you go. There you go. There you go. What do you guys do when your child gets a cold? You got 2, 5 and a 7.
Yes.
What do you do? Well, you know what? You know what's interesting? A lot of parents don't do anything special because we don't want to use over-the-counter medications. And remember, doctors really don't like to give little people medicine unless they really have to. And remember, you're not going to go to the drugstore just because you see all these cough medicines for children. You're not going to take them off the shelf. So very often, parents don't do anything special. But they do get congested a lot of times, and so you do have to kind of deal with that. So how do you help to relieve some of that congestion, especially for the little people who haven't learned to blow their noses yet? First, let me ask Grandma, what did you do in the olden days? No? Fast forward to, what do you do?
Oh, depends on what the situation is. It's period here.
Okay. Anybody use a humidifier? Humidifier, okay. And if you don't have a humidifier, what do you do?
Oh, I do the shower.
Okay.
Well, they're not in the shower, we're in the bathroom.
Right.
And
Turn the hot shower
yeah,
on
so they steam rise.
and get that hot, moist air.
Usually I do it because it gets worse at
Night.
nighttime.
Mm-hmm.
And so if I have to give them medicine, it's something that can help him throughout the sleep, you know, while he's sleeping. Or he's coughing throughout the day, just let him cough it out. But usually it's when it starts getting night, it gets really, that mixed with a little bit of the asthma or, you know, it's like, you know, so.
And one of the things that's also important when we talk about these situations is that if your child has a special medical condition, something like asthma, when children with asthma get a cold, your doctor may give you different instructions. Just like a child with sickle cell gets a fever, your doctor may give you different instructions. So it's different for everybody. But if you have a child that generally has a cold and you feel the congestion, humidifier or the hot shower you run and they breathe in that hot air, or what about in the kitchen, what can you do? Put on a pot of hot water. Yeah, and let the steam, you know, fill the room, okay? Has anybody used that little blue bulb? Yeah, exactly. Usually get it when you bring your baby home from the hospital, a little blue bulb, and you squeeze it and you put the nozzle right at the nostril, and as you let it go, it will pull the mucus out. And how about saline or salt solution, a spray? If you use that first, then use the bulb, it will really help to pull that mucus out, okay? What is one of those old remedies that have been used or parents have done in the past, some of whom may still be doing it, to get that mucus out? Go ahead, you started it. You smiled first. So go ahead, share. And do they suck or do they blow? Okay, so that's one of the ways. You put your mouth over your child's nose and you suck the mucus out. Or you put your mouth over the child's mouth and you blow and the mucus flings into your face. And yes, it works. But the doctors say that they would really prefer you not do that for 3 reasons. Number 3, ew. Number 2, you're putting your mouth directly on their soft tissue. Every germ you've been exposed to all this time you've been on the planet, you're depositing directly into your child's system. And you're getting the heebie-jeebies or whatever they've got. Number one, you're blowing into your child's lungs. You can stop them from breathing, or you're sucking the air out of their lungs. So you're the parent, you get to decide. But like Oprah says, when you know better, you do better. So you have choices. The little blue bulb, saline, humidifier. And if you're really hearing your child struggle, like you say at night your child's breathing gets more labored or whatever, make a call. Make a call. Because there may be a prescription, there may be an over-the-counter that your doctor decides they want your child to have. Okay, but for the most part, coughing is something they want little people to do because it naturally helps to clear the lungs of the mucus or whatever. Okay, what else do you do for a cold? That's pretty much just, you know, natural course of things. Almost the same thing you do for fevers, which is Tylenol if they're having a hard cough or pain, but not so much. More, how about hydrating? Okay, you want to keep your child hydrated, absolutely, positively. One of the reasons hydration is important when a child has a cold is because it helps to keep the mucus thinner, okay? So it's going to be easier to get it up, okay? And the other thing is a lot of times children lose their appetite when they have a cold, so they're not getting as much nutrition in, so you want to make sure they get some of their vitamins and whatever in through liquids, okay, the juices with the diluted water or whatever, and soup, something light, because they usually don't have much of an appetite, okay, and you just want to be careful to monitor their intake because dehydration is important. But basically, colds are pretty common. Again, you guys are the experts, so you really want to pay attention and listen to your child's cold. There are lots of viruses out here. That's what a cold comes from, a virus. Sometimes you got a dry cough. Remember the little girl that had the dry cough? She had that cold for 7 days. She had a sore chest. Well, why was her chest sore? Because that cough was dry, so there was nothing there. So that wasn't necessarily an emergency, not the way that was written. But after your child's had a cold for a couple days, you probably have already made a call. But the way that was written, little girls had a cold for 7 days. How long does a cold last? Yeah, a week to 2 weeks. Actually, a week, 10 days, you're still having maybe a little bit of a cough or whatever. So 7 days is not so scary and out of the ordinary. Chest was a little sore from that dry cough. Make a phone call. You don't have to panic. Again, you guys are the experts, so you want to listen to what that cough is sounding like. Your child may have had 2 colds earlier in the season, but this time she sounds like a seal barking. Okay, that may be a different thing. That may be whooping cough. It may be something else. Your child may have a cold and a fever, but there's a stiff neck that's going along with that. That in combination with some other symptoms could be meningitis. So you're always, that's why it's a good idea to kind of jot down notes when you start to notice something that's starting to, you know, appear, whether it's diarrhea or a temperature and how you've taken it, what it is and what you've given for the temperature. Jot down, because again, every time you make a call to your doctor or to the hotline, all the information you give them is what they determine what they tell you to do. Okay? That's how they decide, get in here quick, or I'll see you tomorrow, or I'll write out a prescription. Okay? But I just want to remind you all that you're not alone with this. You got the 24/7 hotline. You got that primary care physician that you work well with, you communicate well with, you're very comfortable with. You can call as much as you want, as often as you want. And if you're feeling like your needs are not being met, or you're not being heard or understood, or you're getting on their last nerve, then maybe you need to call member services and do something about that. But it's important for not only you all to have healthy children, but also for us on our end to have you have healthy children. So that's part of the partnership. Okay. Any questions or comments about colds, flus, viruses? No. Okay. Remember that. Oh. Okay. Okay. Alice is gonna. I thought we weren't doing that. No.
First of all, what is your name and where are you from?
Sameher El Barouki. I'm from Lebanon.
Ah, I'm Armenian. I have family in Lebanon, but they're all gone.
What did you learn today?
I learned a lot. I learned about like the fever, the cold, the ear infection stuff, and then how I'm gonna just do the first thing for my kids, and they teach me if like I'm not gonna panic, and then don't worry, just like we need help, and they have like 24 hours help, the nurse, the hot call, and that's awesome.
And are you glad you came here today?
Yes, of course. I have school today, but I canceled it to come here because it's really important for me and for my children.
And what would you tell your friends? Would you tell the people that you know that
I'm gonna tell them you should come, and then like you missed it if you don't like you can't come. And then I learned a lot. That's like I want to thank everyone here who did like a lot of things for my children, and then they teach me very important things and new things actually too, like how to hold the stuff, and then how to learn if there's fever, cold, anything, just like, and how to call. Don't go right away to the ER.
Now, you have two children?
I have three
You have
girls.
3 children, and have you been to the emergency room often, or will this help you not go there?
Twice. One when my daughter, she put like earring in her ears, and then the other was high fever for my other daughter.
So because of this class, will you call your doctor first before you go to the emergency room?
Yes, of course. When I called them, they said, okay, just let me know if there is like high fever, and they give you the number. If it's like over that, you should go.
And so you was coming here a big help?
It is.
Okay, I think
Big help.
Thank you.
Thank you.
I have a question. I'm just curious.
Here, come over here.
No.
Or you'll
okay.
answer me the question.
Yeah. Well, just.
Ryan, make sure Chad see you. Okay.
So, I guess, I don't know, is your family here as well? And do you think, maybe not having family close by that,
My whole family here,
your
thank
whole
God.
family's here? Oh, okay. Because I think, I thought maybe not knowing, sometimes when your mom's not around, you don't know what to do when your baby's sick. And
My mom, she helped me a lot, and thank God she's an angel.
oh, good.
Because I'm alone, I'm with the 3 children, and she's been helping me years. Thank God. God keep her healthy, and every mom keep them healthy too.
Amen.
And happy, healthy holiday for everyone.
Thank you.
Thank you.
All right, I'll get the microphone.
I need your battery.
For what, the camera? Oh, yeah.
Don't tell me it's not coming through.
No, we got it.
You got it all.
My daughter
Right, it's not rolling. Here's the battery. And the first one is what's your name? Just talk to me, not the camera.
Okay.
What is your name and how
Nadira.
many children do you have?
My name is Nadira Jones. I have one son. His name is Yazir Jones. He's 3.
And are you getting a good level?
Yep.
All right. What did you learn today? What was the most important thing you learned today?
I learned, the most important thing that I learned today was that not to always panic, and first thing to do was just to run to the emergency room, because every single time I was in a situation, I would just go straight to the emergency room. That would be the first thing I would do. So I learned a lot about that, like don't just run straight to the emergency room, you try to treat it at home, and
So now, how about the phone? I guess having the phone number is good.
Yeah, that was helpful also, because like I said, I told them that my primary care doctor for him, I don't really I like them, but it's just, I feel like there's someone better out there. So them giving me that number, I can call them instead of my primary care, that's a lot of help.
Great. So was coming here a big help then?
Yes, it was. I learned a lot today.
Would you tell your friends? Have you told anybody else? Or?
Yes, actually I tried to get my sister to come with me today, but she said she had to work, so next time I'll make sure I recommend it to others.
What are some of the challenges and barriers that you think prevent people from participating? Like, why do you think more people don't come?
Probably because a lot of people is not really outgoing. They don't like to sit in groups and talk and open up, so I think that's probably what it is.
And what did you find helpful about the class? Did you learn anything new?
Yeah, about what I just told you, and I found out that I really didn't know much about fevers and that they fight infections and stuff like that, because I always thought that a fever was an emergency, you just go straight to the emergency room. So that was something I learned.
we're good.
Okay.
Thank you.
Thank you. Nice meeting you.
Nice meeting you. And so you got to find a new doctor.
Yeah, I'm going to call that number.
All right. You're next. Can everybody
Hey, everybody, can you be quiet?
a little
Chill
bit?
out.
What's
Go
your
out in
name
the hallway.
and where are you from?
Okay. My name is Rogelio. I'm from Philadelphia, Pennsylvania.
How many children do you have?
I got two. One's a boy got 5 years and one girl got 7.
And so, what did you learn today? Are you happy you made it?
I was very excited today because it's very things we learn, something with some ignored. So now it's a good thing.
Have you been to the emergency room often, and do you think coming here will help you avoid going there?
Yes, it was good because you know sometimes some things you don't know, so it's good. They let you know what you can do, and then it's a good thing too.
Would you tell friends and other people to come?
Of course I do. This is my first time, so I want to tell my friends it's good to come over here. I don't know, sometimes like it's take a little longer, but it's good because we share the many things from people who sit on the room. That's good.
What was your favorite part about today's session?
Everything. I think it was everything fun, good.
Did you learn some good information?
Yes. I would say I learned. The most important for me was like what you can do when if it's an emergency or if it's not. That's for me. It's the most important.
Okay, I think we're good. Thank you.
Okay.
That was easy.
Thank you.
Well, what kind of fruit? Green, yes. What kind of fruit reminds us of an apple? There's two, Hezekiah. Oh, of a yellow. What? The apple can be what 2 colors? Actually 3. What 3 colors can it be? Red apples, good.
Green apples.
Green apples and
Yellow apples.
yellow apples. Good job.
This yellow apples right
If
there.
I had orange Play-Doh, well, this is an easy one. What does the orange Play-Doh remind us of? What kind of
Orange.
fruit? Oranges. And what's another name of the fruit that we just tried? Tangerines. Yep. And did I get everyone's color? All right, so while in the next few minutes, what you got, I'm going to let you do a Play-Doh activity. And I want you first, see how many people can make some grapes out of their Play-Doh. Let me see you make grapes out of your Play-Doh. All right, now, some people may know how to do it, some people don't. Do we want to use all our Play-Doh for a big grape, or do we want to break it up? Look at Jeremiah. Jeremiah is using to roll it on the table. Or you could take your palms and roll it in your palms, and then set up your grapes. Now, grapes grow in what we call bunches, okay? So we're going to bunch them together. I have orange grapes.
I have yellow grapes.
Yellow grapes.
Blue grapes.
But this kind of fruit is really good for us because it gives us good natural energy. When we eat candy, we're like this. We start eating that candy, we get all that energy, and all of a sudden, we start to slow down. We get tired. But when we eat our fruit and our vegetables, we get good energy that helps fuel our bodies. So that's one of the things I want you to leave here today. Remember about our hand washing, and remember to make good snack choices because there's lots of good flavored fruit that you can eat that's good for you. How many people their moms give them fruit? I can tell you guys do because everybody in here at least tried something. Good job. All right, we're going to play Play-Doh. The time is 12. It's on the 7 minutes. We're going to play Play-Doh until 12:20. So you have about 10, 15 minutes to have as much fun with your Play-Doh as you want. You can design anything you want. Snowman, that's an excellent idea to build. And that's one of my favorite songs.
He needs help.
You need help? Y'all see you need some help getting it out?
How about Frosty the Snowman? Frosty the
Who knows that song?
song. Good. All right, you want to try it? Okay, ready? Frosty the snowman was a jolly happy soul with a corncob pipe and a button nose and 2 eyes made out of coal. Frosty the snowman was a fairy tale, they say, but the children know he can laugh and play just the same as you and me. Thump, thump, thumpity, thump, thump, look at go. Thumpity, thump, thump, thumpity, thump, thump, over the hills of, what's it go over the hills of?
Snow.
Snow, good. Is that a song you learned in school?
Frosty the Snowman.
Frosty. Let it go, turn it on.
Hold it up. Hold it. It's the wrong way. What?
Now, is one stronger than the other? Hezekiah, don't climb on the table. Is one stronger than the other?
Yeah.
Hezekiah, your side's over here, Dave. No, but let's try it this way. Let's make them get a little speed together, okay? That one will go this way, and this one will go that way. Hands off the track for a second.
It's over there.
Ah! So as it got faster, one of them got stronger, right?
Yeah.
Okay, let's try it again.
All
right, let's try it again.
Yeah.
They're probably about the same. Okay, wait a minute, Hezekiah. Time out.
Yeah.
Good job. All right, are you ready? All right, go.
Come on, do the bridge.
Ready, set, go.
You want to try it, Yasir?
Ambulance! Don't put behind! Come on, ambulance, go! You so pretty! Come on, ambulance!
Not too high. Not too high.
Where's that? Jay, go! Go!
All right, now, if you guys stay real still. Oh, no, it's too light. At night, you can actually see them light up, and the track will light up as they go by.
What?
Yeah, it's pretty cool. I like it.
We could take this home and have one of these, maybe.
Now, turn the cars off for 1 second. I'm going to show you something like this. Now, did you ever see a gerbil go in a cage?
No, it's not cage.
Oh, just take them off for 1 second.
Take them off.
Well, if you ever saw a gerbil go in a cage, if you can see the gerbil move around the track, and he can move his track around as he goes, and he just runs and runs around the track.
I don't know what is a gerbil. Turn it off.
So now we're going to turn the cars off for a second. I'm going to form 2 racetracks, and then you guys are going to line up in groups of 3s, and you're going to race your cars, okay? You're saying, Miss Debbie, how can we do that with tracks?
Miss Debbie, how do we do that?
Well, come on with me. I'm going to show you. All right, everybody line up.
Oh, now I know it. Now I know it.
Come over here, and I need you to sit. 1, 2, 3. Face the line. Thank you, just here. 1, 2, 3, because we're going to do like this. This is the racing line. So Jabri and Hezekiah are first. Everybody sit behind them. Good. Sit behind them. Pick a person to sit behind. 1, 2. 1, 2. And we need, oh, you're in the wrong line, honey. Come back over. Come back over. Thank you. And Gavin, you come over where Jeremiah is. Gavin, come where Jeremiah is. And Yasir, come on with me. All right, you ready? Wait a minute. It's like this. So when the first person goes, then it's going to be your turn. So I need 1, 2, 3. 1, 2, 3. Yasir, sit behind him. Yasir, good job. Gavin, sit behind Jeremiah. All right, now let me demonstrate first. We have 2 tracks, the same size. Everybody agree they're the same size? Yes. One looks a little bigger, doesn't it? Yeah. So let me take a couple pieces out of one.
Oh, now I get. I already know to do this. It's just like when you put the wheel on something else, it goes like a motorcycle in one of those circle things.
I'm gonna show you how to make that too. So, gentlemen, put your car inside your track.
Start the dog.
Okay. Now this is just a test. Ready, set. All right, ready, set, go. Well, they really can't race, can they?
Yeah.
Let's see how far they go. Oh, good job. All right, my next two people come in. My next two people.
It's my turn.
Wait a minute. Move back. Good. Thank you, Hezekiah. Thank you, Japri. It was Jeremiah and Christian. Okay?
Wait, you next.
Okay. All right. And when you're ready, push your button and let's see what direction your car goes in. Hands to yourself. Hands on your own persons. Okay, ready, set.
Hold on.
Is he ready?
No. Hold on.
Don't start it for him. Just show him. Good. You're a very good teacher.
Come on, guys.
Ready, set, go.
Oh, hold on. Push this button. Okay. Ready, set, go. Come on, guys. Push the
Remember,
button.
it's his turn, so only the person who's turning it will take the car.
Yo! Crash!
Good job. All right, turn. Hezekiah, it's not your turn. Whose turn? It was Chris and Jeremiah.
In that one.
I want everybody to have the same turn. Turn the cars off. All right, now it's Yasir and Gavin.